I would now like to talk about advanced care planning. So I've already mentioned that it's really important to understand what the person who you are looking after hopes for as they get closer to death. We can listen to what people hope for. They might hope to stay at home and die at home. They would prefer not to be admitted to hospital, for example, and that could apply to care homes as well, that people would prefer to be looked after right until the moment of death where they are currently living. They might hope not to have extra medications, for example antibiotics, as they get closer to the end of life. But unless we help the individuals record that somewhere, it's possible that as death gets closer, that people are anxious and they call an ambulance, they call the doctor, and that the individual's wishes will not be respected. So a process of advanced care planning has been introduced. And this is a way that we can record the patient's wishes and hopes about where they hope to be cared for, where they hope to die, and anything about treatments and interventions. Usually, that advanced care plan is completed with the patient by a health professional, and that might be the patient's GP, it might be a hospice nurse or doctor who's seen the patient either in a hospice or visited them at home. Or in the case of care homes, it's quite often completed when a person is admitted and comes to live in a care home. And we'd expect that advanced care plan to include details like where the person would hope to be cared for, where they would hope to die, whether they would want or not want to be resuscitated. So you might have heard about Do Not Attempt Resuscitation, so DNAR orders. There's very good scientific evidence that if people are very close to dying and it's a natural death, not a sudden cardiac death in a young person, but somebody has a chronic disease that is leading to their death, that resuscitation is very, very unlikely to be successful. And it's a traumatic process for both the patient and people watching. It is common practice for health professionals to discuss with somebody who is approaching the end of life whether they would prefer for resuscitation not to be attempted. And if they agree to that, that will be recorded in their record as DNAR, Do Not Attempt Resuscitation, often using that abbreviation. Patients people, I shouldn't call them patients, people as individuals may also decide, for example, if they've had a recurrent history of chest infections and have chronic breathing problems, that if they know that they're getting very close to the end of life, they would prefer not to have antibiotics, or they would prefer not to have other treatments. And that can all be recorded in the advanced care plan. Usually, when a patient or person is being cared for at home, there should be a record of their advanced care plan held in the house, and similarly in the care home. So it's important when you start caring for somebody to ask if there is an advanced care plan. It may be called something different, and another type of form that is frequently used is called the respect form, but it contains similar information. The important thing is to try to ascertain whether somebody has one, and if so, where it's kept, and to familiarise yourself with what's written in it and make sure you really understand what the individual wants and hopes for. And it may contain other information like who to call in an emergency numbers for family members and the GP, and so on. Advanced care plans, or the respect forms, need to be completed when somebody has mental capacity. So that means when they can think and make decisions for themselves. And as we know, many people that you'll be caring for have dementia. Now, if they haven't got severe dementia, they can often still make decisions about themselves and still have sufficient mental capacity to complete an advanced care plan or a respect form. And that's really important. And indeed, For people with dementia, it's important to try and engage them in decision making all the time, as much as is possible, even about small things in daily life. Some people who perhaps know they have early onset dementia or are afraid about other things like a severe stroke or something else that prevents them from having mental capacity to make decisions may have completed something called a legal power of attorney. Now, there are two types of legal power of attorney. One is for health and welfare and the other is for finance. The one that is important with respect to end-of-life care is the legal power of attorney for health and welfare. And this nominates somebody to make decisions on behalf of the individual if they lose mental capacity, and usually that will be a family member. Again, it's really important to ascertain whether the person you're looking after has nominated a legal power of attorney, and that should be included in the advanced care planning document or somewhere in the notes that are held in the house and or in the care home. If somebody you're caring for doesn't have mental capacity, i.e. they have severe dementia, then it's important for even daily decisions to make sure you check in with the person who holds legal power of attorney for health and welfare, as they are the person who, by law, is enabled to make decisions on behalf of their loved one.
When it comes to end of life, we have to ensure dignity and respect to their care plan. Many people who we care for have a care plan, and for people that are of end of life, they have their plans. I have a client who died about a few months ago. She said whenever she's healed, we shouldn't take her to the hospital. She already knew she was going to die, but she said she shouldn't be taken to the hospital. So when she fell and I was called to go and look after her, I got there and she said, "Bola, I know I am dying, but I don't want to go to the hospital." I said, but the thing is, we are calling 999 now. The ambulance will be here in a few minutes' time, but I know they want to take you to the hospital the way you are. I said, I don't want to go to the hospital. Unfortunately, when we called the ambulance, she had the siren of the ambulance. She gave up immediately.
The advanced care plans has actually helped a lot, knowing what they want, and we, for my company, we abide with that. We go with that, irrespective of, sometimes we are very emotional, but we just have to abide with what they want.
She will tell you, I need a cup of whiskey every day. That's funny, isn't it? Yes. It's funny. Yeah. So it's part of our care plan, so we have to respect it. So we give her whiskey.